thank you so much for joining me today. Today I am here to inform you about congestive heart failure, or CHF. CHF affects 5 million Americans, most of whom are 65 years of age or older. My grandmother passed away from CHF, so I've learned a lot about this condition. Today I will provide information about what CHF is, how it develops, the symptoms, how it is diagnosed, treatment, and prevention. Okay? So let's first start off by letting you know what congestive heart failure, or CHF, is. This is a condition in which a heart fails to pump the adequate amount of blood to meet the body's needs. Okay? This occurs in two types: left side heart failure and right-sided heart failure. Left-sided heart failure is more common. Left-sided heart failure is edema of the lungs. And right-sided heart failure is congestion of the liver and spleen. I have a diagram of this person, and these are the areas that congestive heart failure affects. Starting from the top, distended neck veins is what you will see in congestive heart failure patients. You will also see pulmonary edema, which is lung edema. You will also have an enlarged heart. There will also be hepatic congestion or liver congestion. There's also spleen congestion. You have abdominal edema, and in your lower extremities, you have edema of your lower legs and your ankles. So those are some of the signs of congestive heart failure. Secondly, how congestive heart failure develops: it develops slowly. It follows other heart conditions such as hypertension, which is high blood pressure, coronary artery disease, and also myocardial infarction, or a heart attack. These are some conditions that are pre-existing to congestive heart failure. The symptoms: you have shortness of breath, either on exertion or at rest. You also have tachycardia, which is an elevated heart rate. This condition is diagnosed. It can be diagnosed by your primary care physician, just with a simple history and physical. And if they notice swelling in your lower extremities, as I mentioned here, the legs and the ankles, or if you're short of breath, that is one way that it can be diagnosed. Also, there are other ways that it can be diagnosed. You can do a chest x-ray, which you notice the heart enlargement, as this picture illustrates. There's also an echocardiogram that can be done, and they're testing for the heart valve function. Also, electrocardiogram, which they test your heart rate. And as I said earlier, some of the symptoms is tachycardia. So the heart rate is increased with congestive heart failure. And some of the treatments that we have here are, and these treatments are designed to decrease the workload of the heart. So they'll put you on diuretics, which are, some people like to refer to as fluid pills. They'll put you on those, and also they'll restrict your fluid intake within a 24-hour period, because you don't want fluid to overload your body. So that's why you're taking the diuretics, and also that's why they put you on a fluid restriction. Also, low sodium diets, we should not put salt on our food once it's plated, okay? And there's also artificial devices that can be used, pacemakers and defibrillators. And as far as prevention, and I know that a lot of times conditions are hard to be prevented, and if they weren't hard to be prevented, then no one would have these conditions, correct? So one of the preventions is weight control. We have to make sure that we maintain a good weight, a good body weight. We also have to make sure that we do diet modifications, and as I said earlier, low salt. You know, water follows salt, so we don't want to keep adding salt to our foods that we eat. We need to do exercise. Make sure that exercise, you know, you're doing good so that your body weight is maintained. And also, if you smoke, stop smoking, because smoking prevents the oxygen levels in your blood, okay? And so, now that we know what congestive heart failure is, we will say that, you know, prevention is the key to preventing congestive heart failure, because we know that congestive heart failure affects 5 million Americans, mostly of whom are 65 years of age or older. And so, just to recap, I have told you exactly what congestive heart failure is, how it develops, and we know that it develops slowly, the symptoms of congestive heart failure, also how it's diagnosed, treatment, and prevention. So we need to start preventing these type of conditions from happening, okay? So as I said, prevention is the key. So prevention, weight control, diet modification, exercise, and stop smoking. Thank you so much for joining me tonight. I have really enjoyed, and I hope that you guys have learned something from this presentation. Thank you so much.
Thank you.